Good afternoon, Pika. How are you today?
I'm doing well. How about yourself?
I'm doing good. Thank you so much for asking. So, thank you so much for coming in today for your session. How's everything been going?
I've been making it. The
Mm-hmm.
resources you provided for me were good. I was able to put some food in the refrigerator and pay the rent and treat my family to a little
Mm-hmm.
bit of a treat for them.
The
It's
children?
yeah, my kids.
Mm-hmm.
Yeah.
Okay, so are you still participating and going on daily walks to help try to relieve some stress?
Yes. I've been walking up this trail near the house, and it helps me to relieve stress as well as
Mm-hmm.
try to build my body up stronger so I
Okay,
don't have to rely on the pills to
I gotcha.
try to lessen the pain. Because if I build the strength, I'll be able to
Mm-hmm.
carry the extra weight, and I'm trying to lose a couple pounds while I'm at it.
Okay, that sounds good. So, today, the purpose of our session today is work on developing coping strategies and to improve your relationship with your family. Is that correct?
Yes.
Okay. So, today in this session, I thought that maybe you and I can review and discuss some goals that a part of as a part of your treatment that we could discuss during your sessions. Okay. So today we're going to be discussing some treatment planning. Okay, based on just some things that you have relayed to me, and if you have any questions or concerns with me reviewing your treatment plan at any point, you can ask. Okay. Okay. So I'm going to start you off in this treatment plan. I'm going to start you off with just two goals. Okay. The first goal is going to be a coping skills goal that you mentioned that you want to learn how to develop healthy coping skills to help you during this challenging time with you and everything that's going on with your family and your relationship with your wife and your relationship with your kids and just even with your body. So your first objective, Pica, is Pica will engage in one coping activity such as walking. You will go for a walk each time you feel the urge to take a pain pill. And you will provide a coping log and the frequency that for this objective is 3 times per week that you will document and walk and document 3 times per week, and we'll discuss it during our therapy session on a weekly basis. Okay, and our target date for this once again is October 7th. Okay, do you have any questions about that?
Uh, no. As
Okay.
of now, I would say my only question is, so would I be bringing my journals in to my next
Yes,
appointment?
that's absolutely correct. Yes, make sure you bring in your journal and your logs for each session as you and I will be reviewing them. Okay.
Mm-hmm.
The next objective for your healthy coping skills or increasing or developing healthy coping skills is you will develop 4 coping strengths. Strengths because you strengths that of things that has worked for you in the past, okay, that we can apply to this situation so that we can um, help improve your situation.
Mm-hmm.
So the intervention, as you will discuss, how each coping strength has helped you overcome daily challenges. Okay, and so the frequency that we're going to do this is we'll discuss it one coping strategy weekly during each therapy session. Does that make any sense? Do you understand? So you're going to be developing 4 coping strengths, and we're going to the intervention is during our weekly therapy session, you'll discuss how these strengths has helped you in the past so that we can apply them to the situation.
Mm-hmm.
These strengths to help improve your situation. And the target date for that will be October 7th, 2025.
What would be an example of a strength I can appeal to?
Okay, so my question to you is like we discussed in our last therapy session, what name a strength that you've used in the past when you've had a struggle or a situation or a difficult or challenging situation? What was one strength that you used that helped? Was it that you was it an example was did you have a stronger support system because you had stated to me that you're not it's just right now you and your family that you don't rely on a support for you, no other support other than your wife.
Yes. So me and my wife, we've been having a hard time, but
Mm-hmm.
she's obviously my rock, and we're trying to rebuild that foundation.
Mm-hmm.
But recently, I have reached out to a few old friends I used to play sports with and everything,
Okay.
and we've reconnected. And it has allowed me to at least have an outlet to speak on my feelings with close people that I know won't judge me,
Okay.
as I work towards trying to rebuild that trust between me and my wife.
Okay, very good. Thank you so much for sharing that. And I'm so glad you actually shared that because that's a part of your part two or your goal, your second goal on your treatment plan is identifying uh, a support system. So we'll talk about that here in a few minutes, okay? But thank you so much for sharing that.
Mm-hmm.
Your third objective is identify two members. Well, that's what it is right now. Identify two members of your support system that you can utilize, okay? Um, and then you will keep your intervention practice. You're going to keep a log of the effectiveness of your support system.
Mm-hmm.
And we're going to discuss that, you and I. We'll discuss it in our therapy session, okay?
Sure.
Okay, thank you so much for bringing that up about the support system. I'm happy to hear about that for you.
Mm-hmm.
Alrighty. The second goal is you will improve or establish healthy relationships with your family. And the objective is first, you will attend weekly family therapy sessions to improve your relationship with your wife. And with your children as well. We'll identify 4 behaviors that are causing conflicts and mistrust in their family relationship.
Mm-hmm.
And the frequency is that you're going to attend one family therapy session each week with your family, okay?
Understood.
And your target date would be October the 7th, 2025.
Mm-hmm.
And also, too, another objective is because I know you said that you are working to strengthen your relationship with your wife. So, and it looks like you are, that's the goal and that's the desire for you. So, Pika and his wife will engage in activities that will strengthen emotional intimacy. And so, the intervention is you and your wife will engage in a 15-minute conversation by using prompt cards as a guide to help improve your communication with each other and to build upon intimacy. And you would do this at least one time per day for 30 days. And we'll discuss it and you'll discuss it in your family therapy sessions. And the target date for that will be October 7th, okay?
Okay.
Objective for this goal is for your healthy relationship or improving your healthy relationship goal is you will maintain a commitment log of intentions and tasks. So we want to try to get you more involved in your home life. So the interventions for that is you will document and track 3 personal and relational commitments. Like whether that be, and I'll give you an example, whether that be helping the children do homework, or maybe reading a book to one of the kids. And the frequency is 2 times per week. And we'll review it at least one time on a weekly basis. So it'll be 2 times per week that you would document and track your intentions. and we'll discuss that in the therapy. And the target date for that is October 7th, 2025, okay?
Okay, for sure.
And also, too, um, do you have any additional questions for me? I think you are making progress thus far, and I'm glad that you were able to utilize the resources, um, to help with your rent and food for your household. I greatly appreciate your time.
Yes, it's helped a lot to
Mm-hmm.
try to get me back on the right path. I know it's not going to happen overnight,
Mm-hmm.
but just thankful my family is being patient with me to try to fix my issues and
Yeah.
rectify all the mistakes I've made. My only question I would have is with my log as far as my intent and actions. Would I be able to get that to you as well in the same journal, like the same
Sure.
amount?
You don't have to. Yeah, you could just use. Get you a nice look, whether it be a notebook, and just keep a log. You don't have to keep track of all of that. I know it's like keeping track of a lot of stuff, but I'm very grateful for your willingness to put in the necessary work to try to improve things. You a copy of the treatment plan that you and I have reviewed, and that are you in agreement with this treatment plan, or
Yes.
are there any changes that you think you would like to make?
Not at this moment. It works for me.
Okay, thank you. And then also I will provide a copy of this treatment plan so that you can review it with your wife as well, okay?
That works.
And alrighty, thank you so much for your time. And then I will have my assistant to reach out to you for our next treatment session.
Thank you.
Thank you. Have a good rest of your day, Pica, and
You
be
too.
safe.